Hello, Donovan here. In today's video, we'll be talking about preeclampsia. What is preeclampsia? Preeclampsia, this is a serious obstetric hypertensive disorder in pregnancy which occurs after 20 weeks of gestation with a systolic equal or above 140 millimeters of mercury and a diastolic equal or above 90 millimeters of mercury, characterized by high blood pressure, proteinuria, and edema. Preeclampsia is one of the hypertensive disorders in pregnancy. What makes preeclampsia unique is that it occurs after 20 weeks of gestation with the presence of high blood pressure, proteins in urine, and edema. There are several types of hypertensive disorders in pregnancy, and I'll just mention of the three. We have preeclampsia, chronic hypertension, which happens before 20 weeks of gestation, and we have gestational hypertension, also known as pregnancy-induced hypertension. The classification of preeclampsia ranges from the severity of the blood pressure, proteins in urine, and edema. There are three classifications of preeclampsia. There is mild preeclampsia, moderate preeclampsia, and severe preeclampsia. Mild preeclampsia has a blood pressure of 140 over 90 millimeters of mercury. For proteins in urine, it's indicated as +1, and edema, it could be +1 or just nil. Moderate preeclampsia has a blood pressure of 150 over 100. The proteins in urine could be +1 or +2, and the edema, it is +2 or nil at some times. Severe preeclampsia has a blood pressure of 160 over 110 millimeters of mercury. Proteins in urine, it could be +2, +3, and edema, we could have +3. This is a dangerous classification of preeclampsia which could lead to eclampsia and actually death of the mother or the fetus. Preeclampsia is an emergency obstetric condition which requires professional interventions. The following are the predisposing factors or the risk factors to preeclampsia. We have chronic hypertension, diabetes mellitus, obesity, history of preeclampsia, chronic nephritis, African American, bad obstetric history. These are some of the risk or the predisposing factors that could lead to a pregnant woman having preeclampsia. Comment down in the comment section about what do you think will be other risk factors to preeclampsia. A pregnant woman with preeclampsia will present with the following clinical manifestation. They are going to have an elevated high blood pressure, edema, which could be localized or generalized edema. Generalized edema is also known as anasaka. They could also have severe frontal headache, visual disturbances, nausea, vomiting, heart palpitations, restlessness, short of breath, and sudden weight gain. What do you think would be the other clinical manifestation that this woman could present with? Remember, preeclampsia is a serious obstetric condition and it requires high-skill professional interventions. Now, let's look at some of the investigations that may help us to come up with a diagnosis for preeclampsia and some possible treatment. The following are the investigations that will help us to come up with a diagnosis for preeclampsia. History taken, physical examination, full blood count, urea and electrolyte analysis, liver function test, and coagulative studies. Comment down in the comment section about some of the investigations that are done to come up with a diagnosis for preeclampsia. How is preeclampsia treated? Remember, preeclampsia, we are trying to prevent presence of seizures. The drug of choice in the prevention of seizures in preeclampsia is magnesium sulfate. Other associated medications include antihypertensives such as methyldopa, hydralazine, and nifedipine. We can even give some steroids like dexamethasone. Dexamethasone helps in the maturation of the fetal lungs. This is some of the medications that are associated or given in the treatment of preeclampsia. Join our online tuition platform for a clear management and nursing management of preeclampsia. What are the possible complications of preeclampsia? To the mother's side, there could be eclampsia, placenta abruptio, cerebrovascular accident, hepatic failure, cardiac failure, and disseminated intravascular coagulation. On the fetal side, there could be intrauterine growth retardation, intrauterine hypoxia, prematurity, asphyxia neonatal, and intrauterine fetal death. This marks the end of our preeclampsia presentation. Thank you for watching.